New River Valley Community Services is the public provider of behavioral health care services for the New River Valley, which includes Montgomery County, Floyd County, Giles County, Pulaski County, and the city of Radford. Those services can range anywhere from behavioral health, which includes mental health services, services for folks with substance use disorders, as well as folks that may have developmental disabilities.
The mission of the Women's Resource Center of the New River Valley is to implement individual and social change. And what we focus on is sexual and domestic violence, the victimization that happens, but also the prevention of that, and the path towards surviving those traumas.
So public health is all about protecting our community. It's not so much the individual, it's about the community's health. So we want to prevent disease and we want to promote health and wellness of all the citizens in the New River Valley.
Well, I think the nature of the population we serve is challenging because most of the folks we serve are indigent, and they struggle with all kind of stressors in their day-to-day lives, whether that be having enough food, having appropriate housing, child care needs, or transportation. So they have a lot of difficulties in their lives on top of having a behavioral health care need. And so that presents specific challenges. Maybe these folks, these individuals or family members don't have the support systems in place to help them navigate some of these stressors. So that can be a challenge in itself in providing services to this population. Along with challenges, funding. Funding's always an issue. When you look at local budgets, state budgets, everyone's trying to do more with less. And I think a lot of our public organizations, public agencies have struggled with budget issues because of lack of funding. It is true that we generate some fees, revenue from fees through Medicaid and third-party insurance. And I can say it's, a lot of those insurance companies and the rates they pay for services don't always keep up with what it actually costs to generate that service or provide that service. What we've seen over the past, I'm going to say 3 years, is there's been more administrative tasks associated with providing those services, such as regulations or added administrative time to do the billing and follow through to generate that service or that fee. And that cost has not been met with an increased rate. So the financial burdens associated with providing those services are a real struggle sometimes.
One of our counselors said it best a few years ago, in that our staff bear witness to people's pain. And our vision of a community free of sexual assault and domestic violence presents some pretty clear challenges, right? So we're working against social norms, and we're working against an undercurrent. We're working against all of the isms, right? So sexism and classism and racism all intersect to create an environment or people who would be willing to perpetrate violence against women and children and men and vulnerable populations. And so I think over the years, one of our consistent challenges has been that preventing this violence means building resilient and healthy relationships and layering protective factors at the individual and the relationship and the community level. And so, yes, we bear witness to people's pain on an individual level, and in doing so, work to stop the intergenerational cycle of violence, right? And so it's not a one-stop shop. Not every survivor needs the same interventions or support, and not every community needs the same interventions or support.
So one of the biggest ones is trust, because we're a government entity. There tends to be some issues with trust, that people might be suspicious of our motives. And a lot of what we deal with are very stigmatizing conditions, and they just don't want people to find out. The social determinants of health is a big thing, people not having access or the means. behavioral change is hard. So a lot of what we do is try to encourage people to change the patterns or change the behaviors, and then taking personal responsibility. Sometimes people tend to forget, with all the rights that we have, there are also responsibilities.
I think what we've seen from COVID-19 is an increased demand for services, and it's been a struggle to make sure that we're in a position to be able to provide those services in a very safe manner. Not only safe for the people we serve, but safe for the clients. Not only safe for the people we serve, but also for the staff providing the service. And we've had to negotiate how we deliver services and add a few maybe extra steps or workflows in the process to make sure that we're providing adequate services in the best way possible to those who need it. And I think most of the clients that we've been able to generate fees to sustain ourselves, they're still getting a service. However, it's been limited because we're doing it through telehealth or teleservice, which instead of maybe doing 3 hours a week or 2 hours a day, maybe now we're limited to maybe 1 unit a week or 1 unit a day, depending on the service. So it has severely cut back on our ability to generate revenue to sustain ourselves during this time.
The pandemic has really taken the work that we've done for 40 years and said, no, you can't do that work that way, right? The Women's Resource Center has worked for a very long time to perfect some of the things that we do. We've added services in the past couple years. We've added children's counselors. We've added a chat line. We've added prevention activities and programming, and we've added legal support. We've added 2 full-time staff just to respond to victims of sexual assault and domestic violence in the hospitals, to be on staff 24/7 to do that. All of those things that we do depend on me being in a room with you, bearing witness to your pain. All of our services are relationship and individual based. Surviving is a thing that we do together. And so the COVID-19 mess has traumatized lots of different systems in lots of different ways. And what it did for us was it made us kind of pivot and consider, how can we continue building relationship with our clients and relationship with our communities when being in a room together is not safe? So for years we've answered the phone by saying, Women's Resource Center, are you safe? That's been our focus. And when we say, are you safe, we're talking about physical safety, emotional safety, relationship safety. Now, that sometimes can feel secondary to health and safety from the pandemic. One of the challenges early on was the stay-at-home order. It in and of itself is not the challenge. The challenge was our anxiety that folks would hear the stay-at-home order and believe that they had to stay in an unsafe home. And the governor did a great job of breaking that out and saying this doesn't mean stay in an unsafe place. But that gets to nuance, right? And the sound bites were, and I understand why, stay at home. And so part of our unique challenges in this time has been helping folks understand that while lots of systems are closed, there are lots of systems that are still open. Our partners in this work are still available. Forensic nurses are still available to do those exams at the hospital. We're still available as a support system.
So trust is definitely an issue. There's so much media coverage. There's so many things in social media, on the news, word of mouth, and people just frankly don't know what to believe, what not to believe. Guidance isn't always consistent, messaging isn't always consistent, so that can be challenging. Fear. A lot of people, we don't know. This is a new situation. We've never had it before, so there's a lot of fear about where things are going. And again, that can be just exponentially increased with social media and the media. And then just changes in services. Everybody kind of clamped down, so services are different. They're not quite as available. So access becomes even more of a problem.
Well, to be honest, I kind of feel like New River Valley Community Services is the safety net when it comes to behavioral health care needs for the population here. I think we do a really good job of trying to manage our resources to provide those services to those in most vulnerable or most in need of services. And I think it's because of our dedicated staff as well as our successful partnerships and collaborations in the community. This work is bigger than just our agency because the needs are much bigger than just the behavioral health care needs. So we rely on our partnerships with the Department of Social Services, with the Health Department, with law enforcement, and try to work together to weave a net together to support each other in our efforts.
I moved to the New River Valley in 2011, and I have loved being part of the safety net here in the New River Valley. I think that every community weaves their own fabric, and here in the New River Valley we have done a really fantastic job of weaving that safety net together in a way that is collaborative. We are fortunate to have folks like NRVCS and our local DSSs and our law enforcement and our forensic nursing program and all of these programs, NRV Cares, and this really rich cadre of nonprofits and for-profits who are all working together to make sure we can fill in those cracks. And what has been amazing since March is seeing that while we're all trying to adjust and pivot to the needs of our community, we're still communicating with each other. And we're still holding the needs of our community in high regard. That's our focal point. And whether that's at board meetings or on Zoom calls or how that plays out now looks different. But we're still in communication with each other. And that's very valuable, I think, to our community.
I think we have a great community of partners who collaborate really well to offer resources and services to our community and those that most need it. So I think that's the biggest safety net.
The safety net that we provide in conjunction with our partners is very important. That safety net allows us to meet individuals where they are, meet families where they are, and provide services that will hopefully prevent them from escalating to a point where they need a higher level of care, such as a hospital, a psychiatric facility. It, in many times, for certain individuals, provides a service to meet a need that hopefully helps people avoid jail, helps families remain intact and not get entangled in the child welfare system. So in a lot of ways, the services that we provide to our clients, hopefully there's an indirect payoff for our communities in that they're not seeing an increased demand in incarceration, or they're not seeing an increased cost associated with child welfare. So I think that safety net is really important. It's a specific level of prevention, hopefully, for communities to avoid larger scale issues.
I think as we settle into the long haul, what we're seeing is this pandemic and the ripple effects to the economy and to jobs and to systems that we've always just kind of held as the baseline, like our kids get to go to school and we get to go to the doctor when we're sick. So when all of these systems are shifting and changing, the safety net becomes even more vital, because our vulnerable populations, our vulnerable friends and neighbors, are becoming increasingly so.
Well, I think it's really important right now. You have a lot of people who are suffering through this. You have people who've lost their jobs. In mental health, right? You have people who have issues that the last thing they want to be doing is socially isolated, and that's what we're telling them to do amid the pandemic. So even now, it's much more important to connect them to the resources, to know those resources are out there, because a lot of times people just don't even know where to turn. And when you have a big safety net and each organization knows what the other ones do, and we can offer more services without duplication of services because of that collaboration and the communication.
I think other things that we have identified to support and enhance our safety net is making sure that we're hiring and retaining top quality staff, providers of behavioral health services. And I think for our community, the other obvious thing that we have to keep in mind is the collaboration with our partnerships. Working in conjunction with the different organizations in the community, whether that's the Department of Social Services or law enforcement, we are all here serving the same population with hopefully the same goals to keep our community healthy.
We have to come to a point where the humanity and the dignity of each of our neighbors gets some of our attention.
I think what we have, and it's that collaboration between community agencies, is key. Any agency that's operating in a silo, you're just not going to have that working together. You're not going to have that communication, so that if one agency knows about a person struggling who needs another agency's resources, it just opens up a lot more. And I think that's especially important now, given the situation with the pandemic.
We are stronger together.
We are stronger together.
We are stronger together.